everybody. Myself, Dr. Alokit Sharma. I'm second year resident presenting a paper on retinopathy in blood dyscrasias and its impact on visual impairment and quality of life. The term blood dyscrasias pertains to abnormalities in the cellular components of the circulatory fluid encompassing RBCs, WBCs, and platelets. Blood dyscrasias pose significant challenges to health and manifest a wide spectrum of ocular, particularly retinal effects. The vulnerability of retina arises from the delicate and intricate nature of its structures, resulting in a diverse array of ophthalmic presentations. Anemia is one of the most prevalent abnormalities, followed by leukemia, thrombocytopenia, and more. Hemodynamic shifts and direct infiltration by leukemic cells, among other factors, render the retinal circulation susceptible to hypoxic damage. Fundus examination serves as a unique window, affording an unparalleled direct view through which vascular alterations associated with blood dyscrasias can be observed in vivo. There exists a dearth of literature addressing the impact of blood dyscrasias on quality of life related to vision. This cross-sectional study emphasizes on retinopathy and its influence on the quality of life associated with vision in individuals with blood dyscrasias. The aim of my study is to study retinopathy and its impact on vision-related quality of life in people with blood disorders. So this is a cross-sectional observational study carried out for a duration of 1 year and 9 months, and consecutive sampling technique was used for participant selection. Patients of all age groups and both genders were included, and patients having diabetes, hypertension, AIDS, renal failure, dense cataractus changes, and other media opacities which preclude posterior segment examination were excluded from the study. A total of 200 eligible cases were selected. The medical history and records with prior hematological investigations were taken, and detailed ocular examination was carried out. Fundus diagrams and photographs were captured. The assessment of vision-related quality of life was carried out using the National Eye Institute Visual Functional Questionnaire 25, validated interview version of the NEI VFQ25 were administered to participants during in-person interviews at the hospital. This questionnaire included inquiries related to general health, vision difficulties in performing activities, and responses to vision-related challenges. In our study, iron deficiency anemia was found in 52% of the total patients, which are followed by AML, ALL, thrombocytopenia, CML, and CLL, and others. In our study, most common retinal finding was venous dilatation and tortuosity, which was followed by intraretinal hemorrhage, white-centered hemorrhages, soft exudates, subhyaloid hemorrhages, arterial attenuation, and others. In our study, venous tortuosity and dilation was the most common retinal finding in iron deficiency anemia, which was followed by intraretinal hemorrhages, soft exudates, white-centered hemorrhages, and arterial attenuation. In B12, vitamin B12 deficiency, the most common retinal finding was intraretinal hemorrhages, which was followed by white-centered hemorrhage, arterial attenuation, and venous dilatation. In sickle cell anemia, the most common retinal finding was intraretinal hemorrhage. The prevalence of retinopathy in leukemia in AML and ALL, the most common finding was venous tortuosity and dilatation, which was followed by white-centered hemorrhages, which was followed by intraretinal hemorrhages and vitreous hemorrhage. In thrombocytopenia, the most common retinal finding was venous tortuosity and dilatation. In other blood dyscrasias, the venous tortuosity and dilation was found to be the most common retinal finding. The current investigation unveiled a noteworthy nexus linking retinopathy with the realm of blood dyscrasias and the subscales of NEI, VFQ encompassing general vision, near activities, distance activities, mental health, color vision, peripheral vision, role difficulties, and social functioning. Nevertheless, within the domains of ocular pain, dependency, and driving, our findings failed to disclose any statistically consequential associations. Anemia often presented with characteristic retinal manifestations including hemorrhages, rod spots, exudates, cotton wool spots, retinal edema, and venous tortuosity. Anemic retinopathy was more likely to occur in severe anemia. However, leukemic retinopathy encompassed retinal findings such as pre-retinal and intraretinal hemorrhages, rod spots, cotton wool spots, exudates, retinal venous tortuosity, perivascular sheathing, and neovascularization. In this study, 47.6% of leukemia patients exhibited leukemic retinopathy. Retinopathy was seen in 56.25% of patients with thrombocytopenia, particularly in patients with in which anemia was co-associated. Vision-related quality of life was assessed using composite scores, with general vision most significantly impacted, followed by other aspects such as distance activities and color vision, etc. To conclude, the realm of blood dyscrasias present a significant global health challenge, often leading to various vision-threatening complications. Our study underscores the critical importance of regular ophthalmic screening and fundus examinations for individuals with blood dyscrasias, both as an initial assessment and as an ongoing monitoring strategy to avoid detrimental impacts on their vision-related quality of life. These are my references. Thank you.
Yeah. A nice presentation, Dr. Alokit. A lot of useful data, excellent data. Couple of things which you can better yourself. The slide was packed with too many lines. Okay, it was little too crowded, and you did not define your inclusion criteria very well. You have not defined the blood dyscrasia, just a one term. So what is your inclusion criteria in terms of the disease, diagnosis one, second the blood test. So then you will know like what are the sampling criteria. The sample size which you are taking comes from this particular sampling. Any patient who has a blood, the diagnosis proven by this particular test with this is the value, cutoff value, this will be included. So if you make these changes and little more subgroup analysis, it will be an excellent data to publish.
Thank you. You mentioned retinal venous tortuosity is the most common feature.
Yes, sir.
In all dyscrasias. Have
yes,
you
sir,
further studied why it is so?
Sir, because of most of these blood dyscrasias cause retinal hypoxic changes mostly, and because of that, the first manifestation to occur in the retina is vascular dilatation.
That's why I mentioned if you do a subgroup analysis, there is hyperviscosity is one thing which can happen. There's an anemia, another thing. So there are two things which are playing here. One is ischemia, another one is hyperviscosity. There's sluggish blood flow. So if you do a subgroup analysis, add to that an OCT or an FA, other ocular diagnostics, this will be an excellent data to publish.
Thanks.